All right. Hello, welcome, and thank you so much for joining our third Open Studio workshop. Every last Wednesday of the month, one of our team members will be facilitating a workshop on a topic related to music therapy, therapeutic uses of music, and the work we do at Harmonic Changes. Our Open Studio workshops are intended to be for informational purposes and as a way to connect with our communities. These events are free, and registration is required to receive the access link and attend the event. To find the registration link, you can sign up to receive our newsletter and email blast through our website, or you can follow us on social media. I will provide our social media handles and contact information at the end of this presentation. This event is being recorded, and you will be able to view it on YouTube, our YouTube channel, once it's uploaded there. So before we begin with our topic, I want to introduce you to our company, Harmonic Changes Therapy Services. Harmonic Changes, formerly known as Marlee Music, provides many services, including individual and group music therapy, traditional and adapted music lessons, and music workshops. We are currently providing services in Los Angeles, Chicago, and via telehealth. If you are interested in receiving more information about the services we provide, you can contact us through our website at harmonicchanges.com. So my name is Marlee Simon, and I've been a board certified music therapist in Los Angeles since 2015. I completed my undergrad studies in music therapy with a minor in psychology at Berklee College of Music, and am now currently earning my master's degree in counseling with an emphasis in marriage and family therapy. As of February, I am an NMT affiliate, and I've had several years of experience working as a music therapist with people of all ages and abilities. I've been working for Harmonic Changes since 2018, and I'm now the regional supervisor in Los Angeles. This evening's topic is an introduction to music therapy with neurological disorders. So please note that the material shared in this presentation is meant to be an introduction to the topic and is for informational purposes only. It's general in nature and is not intended to and should not be relied upon or construed as training nor treatment of any diagnosis or disorder. Please sign up for a consultation through our website if you are seeking more information regarding an assessment and treatment for a specific individual. And if you have a question about the material during the presentation and or want to inquire about a consultation, you're welcome to share your question in the chat box. You can also send an email to info@harmonicchanges.com or to me directly at marlee.s@harmonicchanges.com. All questions related to the material will be answered in a follow-up post on our blog within the next week. Any personalized consultation-related questions will also be responded to in a timely manner by our administrative team. So during this presentation, I will be exploring key definitions related to neurological disorders and music therapy. I'll discuss the relationship between music and the brain, and I will also provide an overview of neurologic music therapy techniques. According to the American Music Therapy Association, music therapy is an established health profession in which music is used within a therapeutic relationship to address physical, emotional, cognitive, and social needs of individuals. After conducting an assessment of strengths and needs of each client, a music therapist provides treatment using creating, singing, movement, and/or listening to music. Through music involvement in the therapeutic context, clients' abilities are strengthened and transferred to other areas of their lives. Research in music therapy supports its effectiveness in overall physical rehabilitation and facilitating movement, increasing people's motivation to become engaged in their treatment, providing emotional support for clients and their families, and providing an outlet for expression of feeling. According to the Neurologic Music Therapy Academy, Neurologic Music Therapy is a research-based system of 20 standardized clinical techniques for sensory motor training, speech and language training, and cognitive training. Treatment techniques are based on scientific knowledge in music perception and production, and the effects thereof on non-musical brain and behavior functions. Therapeutic goals and interventions address rehabilitation, development, and maintenance of functional behaviors. The NMT evidence-based model operates on the basis that the structures, patterns, and expressive qualities of music, such as meter, rhythm, melody, timbre, pitch, dynamics, and harmony, can be utilized in such a way to support development and enhance functioning of our executive functioning, perception, emotions, motor control, attention, memory, and language. The Transformational Design Model, or the TDM, designed by Dr. Michael Tout, provides a system for translating the scientific model to functional music therapy practice, specifically in regard to NMT. There are 6 steps to this model, including conduct a diagnostic and functional assessment of a client, develop therapeutic goals and objectives, design and implement functional non-musical therapeutic exercises, create and incorporate functional therapeutic music exercises, reassess progress, and then transfer the therapeutic learning to functional real-world applications. Neurologic music therapy is just one subcategory within music therapy practice. Music therapy treatment of neurologic disorders is not exclusively conducted with NMT. However, there's so much research that demonstrates the efficacy of NMT techniques with neurologic disorders. One must seek additional training to ethically use NMT techniques in their music therapy practice. A board-certified music therapist can take a 36-hour advanced level training with the NMT Academy and become an NMT affiliate. The NMT is not a certification, nor is it a credential. It's a designation earned by the completion of the NMT Institute training and maintained by following the standards for academic affiliation. The NMT training includes information on research in the field of neurologic music therapy, music in the brain, and instruction for how to facilitate the 20 standardized techniques to support clients in meeting their sensorimotor, speech and language, and/or cognitive goals during treatment. According to the World Health Organization, neurological disorders are diseases of the central and peripheral nervous system. These systems involve the brain, spinal cord, cranial nerves, peripheral nerves, nerve roots, autonomic nervous system, neuromuscular junction, and muscles. Hundreds of millions of people are affected by neurological disorders around the world. There are several types of disorders of the nervous system, including vascular disorders like stroke, structural disorders like brain injury, functional disorders like headache and epilepsy, and degeneration disorders like Parkinson's disease, multiple sclerosis, dementia, and Alzheimer's disease. Common signs and symptoms of nervous system disorders include persistent or sudden onset of headache, loss of feeling or tingling, weakness or loss of muscle strength, loss of sight or double vision, memory loss, impaired mental ability, lack of coordination, muscle rigidity, tremors, and seizures, back pain that radiates throughout the whole body, slurred speech, and impairment affecting language expression and comprehension. Neurodevelopmental disorders, such as autism and ADHD, are characterized by a group of conditions due to an impairment in physical, learning, language, or behavior areas. These conditions begin during the developmental period of life and may impact day-to-day functioning and can often last throughout a person's lifetime. Dr. Oliver Sacks, neurology professor, best-selling author, and physician, was a great support and advocate of music therapy with neurological disorders. In his book, he discusses the benefits of music therapy with his patients and reports that patients with neurological disorders who cannot talk or move are often able to sing and sometimes even dance to music. It can also help to ease the trauma of grieving, lessen depression, and provide an outlet for people who are otherwise withdrawn. According to Dr. Sachs, music therapy is a tool of great power in many neurological disorders like Parkinson's and Alzheimer's because of its unique capacity to organize and reorganize cerebral function when it has been damaged. There is not one single music center of the brain. When we are engaged in music, our brains light up and become active. Several parts of the brain are involved in music processing and production. Neural networks that process music also process other functions such as language, auditory perception, attention, memory, executive function, and motor control. If a person experiences a deficit, degeneration, or damage to a certain part of their brain, they may struggle to function. Brain scans can often demonstrate which part or parts of the brain have a deficit, and this can help us to understand why a person may struggle with a certain function. Research shows that engaging in music can help individuals to strengthen their brain centers and neural pathways to enhance functioning. So the frontal lobe is used for thinking, decision-making, and planning. Listening to and analyzing music, as well as making decisions of which instrument to play at certain times or in what sequence, can enhance frontal lobe function. The temporal lobe processes what we hear, affect and emotions, language, and certain aspects of visual perception. For most people, music is a listening and a feeling experience. The occipital lobe processes what we see and is activated when we are listening to and reading music. The parietal lobe, responsible for language, spatial information, and somatic sensation, supports our ability to interpret music and sounds in the right hemisphere and language and words in the left hemisphere. There are two well-known areas of the brain responsible for speech, Broca's area and Wernicke's area. Broca's area enables us to produce speech. Music expression, such as playing an instrument and singing, can enhance communication skills. Wernicke's area comprehends written and spoken language. This part of the brain is used and can be strengthened by listening to and analyzing music. The cerebellum coordinates movement and stores physical memory. This can be activated and strengthened when we play an instrument and/or move to music. There are many other areas of the brain that become activated with music. The nucleus accumbens seeks pleasure and reward and releases dopamine. Listening to and engaging with preferred music increases dopamine function. The amygdala processes and triggers our emotions. Music can control and regulate fear. It can pump us up and/or increase pleasure. When you experience the chills or shivers in response to music, it means that the amygdala is activated. The hippocampus produces and retrieves memories, as well as regulates emotional responses. Music may increase neurogenesis, which allows production of new neurons and improved memory. The hypothalamus maintains the body's status quo. It releases essential hormones and chemicals for regulation. Listening to music for relaxation can support the hypothalamus by reducing heart rate and blood pressure. The corpus callosum enables right and left hemispheres to communicate. It supports coordination of body movement and complex thoughts that require both logic and intuition. It takes brain coordination while doing any sort of musical multitasking, including playing an instrument while reading sheet music. Lastly, the putamen processes rhythm and regulates body movement and coordination. While music increases dopamine, the pleasure neurotransmitter, it can also increase our response to rhythm. This can be observed through simply tapping your hand or your foot to the beat of a song or walking to a beat. Neuroplasticity refers to the brain's ability to change and adapt in response to new experiences. Exposure and experience create new connections between neurons. Our brains can change in the structure and function as a result of learning, training, and environmental influences, especially with music. Now I will go over the 20 standardized evidence-based techniques of NMT. This is not meant to be a replacement for the training, but just an overview of the techniques and their purpose in music therapy and NMT. It is recommended that you take the advanced level NMT training course to learn the rationale for and implementation of these techniques prior to facilitating them with clients. These research-informed techniques are designated by 3 categories: cognition, speech and language, and sensory motor functioning. Attention and perception training techniques are used for just that, to target attention and perception of stimuli. There are 4 attention and perception training techniques in NMT practice. Musical sensory orientation training, or MSOT, is used to stimulate arousal and recovery of wake states and to facilitate meaningful responsiveness and orientation to time, place, and person. In more advanced recovery of developmental stages, training may involve active engagement in simple music exercises to increase vigilance and train basic attention maintenance. This technique is typically used with clients with dementia, developmental disorders, and those who are in coma and/or emergent states. Musical attention control training is a technique used with those who experience difficulty attending to sounds, such as those diagnosed with autism, ADHD, stroke, TBI, psychiatric disorders, and dementia and Alzheimer's disease. The goal of MACT is to practice different types of attention functions through structured, active, or receptive music exercises. Music elements act as cues for practicing specific music responses. Musical neglect training, or MNT, utilizes instrument play or receptive music listening to support attention and focus toward a neglected or unattended visual field and to stimulate hemispheric brain arousal. MNT is used with clients who experience left neglect as well as right or left visual inattention, which is frequently caused by stroke or TBI. Auditory perception training, APT, is the technique used with those who experience difficulty discriminating different sounds, such as those with neurological disorders, with sensory deficits, autism, and ADHD. The goal is to support clients in discriminating and identifying different components of sound by identifying whether sounds are louder or softer, higher or deeper, longer or shorter, same or different, etc. An additional technique used with APT involves integrating different sensory modalities like visuals, tactile, or kinesthetic input into the music experience. Memory training techniques are meant to target the various types of memory, such as declarative episodic memory, which typically involves specific events in a person's life, their name, the year they were born, echoic memory, which involves information integrated in the past 3 to 4 seconds, working memory, which addresses information integrated in the past 25 to 30 seconds, and long-term memory, which is memory from past several months to several years. Musical mnemonics training, MMT, is typically used with clients with dementia and Alzheimer's disease, stroke, TBI, multiple sclerosis, and some psychiatric disorders to exercise memory encoding, decoding, and information recall. Music stimuli can be used as a mnemonic device or a memory template in a song, a rhyme, a chant, or to facilitate learning of non-musical information by sequencing and organizing information in structured patterns or chunks. While using MMT, a music therapist might create a song to help a client learn non-musical information, such as their own name or family members' names, reality orientation related information, like the current year, day, or time, and other important information a client might need to know. Musical echoic memory training, MEMT, is used to support immediate memory recall with persons with TBI or stroke. A music therapist might play a song, stop the song, and then ask the client what the last word they heard was to test their immediate memory recall. Associative mood and memory training, AMMT, is used to induce mood-congruent mood states to facilitate memory recall. This technique relies heavily on the connections between music, mood, and memory. An example of AMMT would be to play a familiar song for a client and then to ask them questions related to the song and/or associated memories with the song. People with dementia, Alzheimer's disease, and other neurologic or memory dysfunction due to aging typically benefit from this technique. Executive functioning relates to skills like organization, problem solving, decision-making, reasoning, and comprehension. Musical Executive Functions Training, MEFT, is a technique that helps people with TBI, stroke, psychiatric disorders, and other executive functioning deficits to practice executive functioning skills through music improvisation and comprehension exercises. With MEFT, a music therapist might give directions to a client that prompts them to practice initiation, inhibition, planning, adjustment, and evaluation skills while playing music. Music therapists can also help clients to organize their ideas into sound and help them to learn to make decisions and trust themselves through the music-making process. Psychosocial behavior training addresses mood, affect, and behavior. Musical Psychosocial Training and Counseling, MPC, is used with persons with psychiatric disorders and TBI to support mood vectoring, cognitive reorientation, affect modification, social competence, and behavior modification. Music therapists may design and facilitate music role-play exercises to encourage clients to establish cohesion with others while practicing skills like assertiveness, confidence, and mood regulation through instrument play. So those are all of the cognitive domain techniques. So now we'll move on to speech and language. Speech and language techniques are utilized with neurological disorders to support integration of expressive and receptive language, intelligibility, articulation, initiation, voice control, and development. Melodic intonation therapy, MIT, is used with clients who have expressive or Broca's aphasia to help them facilitate speech production by singing. Some of you may be familiar with Gabby Giffords, a politician who sustained a severe brain injury after an attempted assassination in 2011. She received music therapy services and utilized melodic intonation therapy with her music therapist to relearn how to speak. Musical speech stimulation, MUSTIM, is used with persons with expressive aphasia and primary progressive aphasia to help them maintain speech. This technique may look like singing a familiar song and then seeing if a client can fill in the blank. Vocal intonation therapy, VIT, is used with persons with voice disorders to train aspects of voice control, including inflection, pitch, breath, control, timbre, loudness, phonation, resonance, and intonation. Many people with neurological disorders are affected by poor vocal quality, including those with Parkinson's or brain injury. The act of singing naturally heightens various elements of speech production as an augmented form of vocal loading, respiratory shaping, resonant voicing, exaggerated articulation, and prosthetic phrasing. Therapeutic singing, or TS, is used with a variety of neurological and developmental speech and language dysfunctions to facilitate initiation, development, articulation in speech and language, and to increase functions of the respiratory apparatus. Rhythmic speech cueing, RSC, is used with persons with fluency disorders to decrease stuttering and cluttering, with persons with dysarthria to control the rate of speech and increase intelligibility, and persons with apraxia to facilitate rhythmic sequencing. Oral motor and respiratory exercises, or OMREX, involve the use of music materials and exercises, mainly through sound vocalization and wind instrument playing, to increase articulatory control, respiratory strength, and function of the speech apparatus. Persons with dysarthria, muscular dystrophy, disorders affecting speech motor control, disorders affecting respiratory function, and developmental speech disorders may benefit from this technique. Developmental speech and language training, DSLM, is used with children with developmental and speech delays to enhance and facilitate speech development through music. Clients may be engaged in music exercises such as singing, chanting, playing instruments, and combining music, speech, and movement to help them develop speech sounds, appropriate context, vocabulary development, cognitive concepts, and educational applications. Symbolic communication training through music, or SYCOM, is used with persons who have expressive language deficits and/or have dysfunctional or absent language development by helping them to build and enhance understanding of rules, functioning, and meaning of language interaction. This technique is sensory structured and can be facilitated non-verbally, like with instruments, to broaden a client's communication skills. And now we will move on to sensory motor techniques. So sensory motor techniques support development of sensory and motor aspects of bodily activity. Persons with neurological disorders sometimes have deficits that inhibit them from utilizing a range of mobility and functionality in daily life. Sensory motor techniques can help to target goals like walking, dressing, transitioning from sit to standing, or completing other activities of daily living with mobility. Pattern sensory enhancement, or PSE, is a technique which uses music to provide temporal, spatial, and force cues for functional movements and activities of daily living. Music can be a motivating force to help a person to assemble single, discrete motions, like arm and hand movements during reaching and grasping, into functional movement patterns and sequences. This might be a relevant skill for someone who is learning to dress themselves or transition from sitting to standing. Therapeutic instrumental music performance, or TIMP, uses playing instruments in an intentionally therapeutic and meaningful way to exercise and stimulate functional movement patterns. Functional goals targeted with this technique may include range of motion, endurance, strength, functional hand movement, finger dexterity, and limb coordination. Instrument placement would be determined by the desired functional movement rather than placed and played in a typical manner. Rhythmic auditory stimulation is a technique used to facilitate the rehabilitation of intrinsically biologically rhythmical movements, most importantly gait, which is a person's walking pattern. RAS uses the physiological effects of auditory rhythm on the motor system to improve the control of movement and rehabilitation of functional, stable, and adaptive gait patterns in patients with significant gait deficits due to neurological impairment. So as you can see, there are many techniques that can be utilized with persons with neurological disorders and neurodevelopmental disorders. However, these techniques are not one size fits all. For example, not everyone with Alzheimer's disease would benefit from all the memory techniques. Techniques are utilized within a specific individual's treatment plan if and only if it is determined by the music therapist that the technique or techniques would be an appropriate way to support a specific client in reaching their unique therapeutic goals. To quote Dr. Oliver Sacks one more time, music can lift us out of depression or move us to tears. It's a remedy, a tonic, orange juice for the ear. But for many of my neurological patients, music is even more. It can provide access, even when no medication can, to movement, to speech, to life. For them, music is not a luxury, but a necessity. For more information about the neurologic music therapy including information on research, techniques, and how to become trained in NMT, you can visit the NMT Academy website. For information about music therapy and its benefits, you can visit the American Music Therapy Association website. And lastly, for more information about how to access music therapy and NMT services, either in person or via telehealth in Los Angeles and Chicago, you can contact us at info@harmonicchanges.com. And feel free to share our contact information if you know someone who can benefit from music therapy and/or neurologic music therapy. Be sure to visit us and follow us on social media for updates about our services. Here are our social media handles. Feel free to contact us via email, phone number, or website with questions and inquiries about services we offer. Once again, if you had a question at any time during the presentation, I'll be sure to look for it in the chat box or in my email box. And be on the lookout for a follow-up blog where all general questions asked during the presentation and/or via email will be answered. Thank you for joining me this evening for our Open Studio workshop. Have a great rest of your day.